Our schools in the area are still doing well in general. Case numbers are low. But as we talked about over the last couple weeks, our kids aren't vaccinated. And we are starting to see cases of transmission from child to child, but not in the school. It's sometimes in the after school curriculars, occasionally in athletics, play dates, sleepovers, and social activities, household exposures. So we're going to have to continue to be careful with our kids and be mindful that they can still get it. Interestingly, I've heard some things lately that are a little bit disturbing and frustrating about that from parents saying, well, where the parents are vaccinated and the grandparents are vaccinated, so maybe you should just let the kids get it, and then we'll all be immune, right? So I don't think that's a good idea. It's not the time for the COVID version of the chickenpox party. Because while kids generally do well when they get COVID, if you have a child who has it, and then there's a parent and then there's a visit to grandparents, or the grandparents come over, even though they're vaccinated, there is a chance they could get COVID from the child. It's not high, we'll talk about it in a minute, but it is still possible, and I don't know if that's a risk anyone wants to take. The other thing about kids getting it is, they're going to be out of school for 10 days. Not a good time of year to be home in quarantine rather than in class. And lastly, sometimes kids don't do as well. It's unusual, but it does happen, including the multi-system inflammatory disorder that we've heard about. Which is unusual, but can be quite severe in children, and occasionally there are kids hospitalized with it. Doesn't happen often, but it does happen. So why take the risk? So instead, let's wait to get our kids vaccinated. And while we're waiting, let's just be mindful. I'm not saying don't let the kids go to the playground. Playgrounds are largely safe unless they're packed with people. I'm not saying don't let the kids have a play date. But just be kind of careful about how you do it. Keep the bubble fusions down to a small number with the play dates. Sleepovers, still not a good idea. Maybe if you're going to sleep over in the backyard and have separate tents, it's fine, but I've never met a 12-year-old who wants to be in a tent by themselves. So let's hold off a little bit on some of these extended social activities. And wait for a vaccine. Going to the swimming pool, it's probably okay. Supervised athletic events, probably okay, but watch out for the social interactions that can occur afterwards.